Alright, let's dive into the wild world of American healthcare. Buckle up, because we're about to unravel a system that often feels like a bad joke played on the average citizen. Seriously, it's like a horror movie where the monster is actually the medical bills piling up on your kitchen table and the protagonist, our wallets, never stand a chance. First off, let's talk about the jaw-dropping costs. You ever notice how just walking into a hospital feels like stepping onto a movie set where everything is ridiculously overpriced? It's like going to a fancy restaurant where the menu doesn't have prices listed, and by the time you get the bill, you're staring in disbelief like you've just been robbed. A trip to the ER? Sure, just a casual $1,000 for a few stitches. And if you need a CT scan, better grab a second mortgage because that'll set you back a couple of grand. It's not just the emergencies either. Regular visits to a doctor can leave your wallet gasping for air. You think you're going in for a quick checkup, but suddenly, you're hit with fees for every little thing. Lab tests, imaging, the nurse's time, and of course, the doctor's expert opinion, which somehow costs more than your car. The sticker shock doesn't just end with the initial visit. You might think you're in the clear after paying for a service, but here comes the avalanche of follow-up bills, lab results, medications, and don't forget the convenience fee for accessing your own medical records online. It feels like every time you turn around, someone else has their hand out, and you're left wondering where your money went. Now, let's get to the real tragedy. People going bankrupt due to medical bills. Imagine being in a hospital bed, hooked up to machines, and your biggest worry isn't your health, but how you're going to pay off the mountain of debt that's about to crush you. A recent study found that medical expenses are the leading cause of bankruptcy in America. It's like a cruel joke. You get sick, and then the system says, "Congratulations, you've just won a lifetime of debt." People often have to choose between getting necessary medical treatment and keeping their homes. It's beyond absurd. You hear stories of families forced to sell everything they own just to pay for a surgery that should have been covered. What kind of twisted reality are we living in where getting sick could cost you your entire life savings? It's enough to make you want to scream into the void. I remember a story about a young woman who had a pretty standard appendectomy. Simple procedure, right? But when the bills started rolling in, she realized she was looking at nearly $40,000 in total costs. Despite having insurance, she was faced with an impossible choice: fight the hospital, which she knew would drain her emotionally and financially, or just accept her fate and plunge into debt. This is the harsh reality for countless Americans. Instead of focusing on healing, they're caught in a vicious cycle of financial ruin. Now, let's shine a light on the hospitals themselves. You might think they're these altruistic institutions, dedicated to saving lives and making the world a better place. But dig a little deeper, and you'll find a different story. Many hospitals are more focused on profits than on patient care. It's all about the bottom line. If you think about it, there's something inherently wrong when a place that's supposed to heal you is raking in millions in profits while patients are drowning in debt. Look at the way they market their services. They're like a car dealership, trying to upsell you on every little thing. Need an MRI? Sure, that's an extra $3,000. And while you're at it, how about a nice, shiny consultation with our specialist for just $500? It's sickening how they prioritize money over compassion. Staff might genuinely want to help, but the system they're stuck in seems hell-bent on squeezing every last dollar from patients. And let's not even get started on the sheer inefficiency of the system. You go in for a simple issue, and suddenly, it spirals into a full-blown ordeal. Doctors are forced to order unnecessary tests just to protect themselves from lawsuits or to meet some arbitrary billing requirement. Meanwhile, patients are left wondering if they're being treated or just being used as a cash cow. Then there's insurance. Oh boy. Insurance companies are like that middleman in a bad deal who somehow manages to make everything worse. You pay your premiums like clockwork, thinking you're covered, but when the time comes, they pull the rug out from under you with fine print and loopholes that would make a lawyer's head spin. Imagine dealing with a health crisis only to find out your insurance won't cover a particular procedure because it's out of network. Or, heaven forbid, you get hit with a surprise bill because you unknowingly saw a doctor who wasn't in your plan. It's like playing a game where the rules keep changing, and you never win. People spend hours on the phone, navigating labyrinthine systems, just trying to figure out what they're even covered for. It's enough to drive anyone to madness. And let's talk about pre-existing conditions. The stress of worrying whether your coverage will be denied based on a previous illness is a burden no one should have to bear. This fear often leads people to avoid seeking medical attention until it's absolutely necessary, which just exacerbates health issues and can lead to even more expensive treatments down the line. Let's not forget the emotional toll all of this takes. It's not just about the money. It's about the stress, the anxiety, and the fear that accompanies health issues in this country. You could be facing a serious illness, and instead of focusing on healing, you're stressing about how to pay for it. Families argue over finances, friendships strain under the pressure, and mental health plummets. It's a ripple effect that can destroy lives beyond just the medical debt. People often feel isolated, like they're the only ones in this terrible situation. The shame of not being able to pay your bills can be overwhelming. It's not just a financial issue. It's a deep emotional wound. The system turns people against one another, creating a culture of shame and blame rather than support and solidarity. So, what's the solution? Many people look to other countries for inspiration. In places with universal health care, the idea is simple. Health is a right, not a privilege. People aren't worried about going bankrupt because they got sick. Instead, they can focus on getting better. Wouldn't that be nice? Imagine a world where healthcare doesn't feel like a loaded dice game, where you can actually get help without the fear of financial ruin looming over your head. Countries like Canada and those in Scandinavia provide excellent examples of how a different approach can work. Their systems prioritize accessibility and affordability, showing that it's possible to offer quality care without the crippling costs. People can walk into a doctor's office and receive care without worrying about whether it'll lead to financial disaster. The US could adopt similar models, creating a system that emphasizes prevention, wellness, and access. Imagine a world where healthcare workers are not just employees in a profit-driven machine but caregivers who are truly focused on the well-being of their patients. It would require a massive overhaul, but it's a change that could benefit everyone. In conclusion, American healthcare often feels like a giant scam. Between the astronomical costs, the crushing debt, the profit-driven motives of hospitals, and the labyrinthine insurance mess, it's a nightmare that far too many people face. We shouldn't have to choose between our health and financial stability. It's time to wake up and demand a system that prioritizes people over profits, that values health as a right, not a luxury. Because in the end, everyone deserves the chance to heal without the fear of financial ruin looming over their heads. We need a healthcare system that doesn't leave people feeling like they're on the losing side of a rigged game. Unfortunately, that does not seem to be the case anytime soon. The only good advice that can be applied today is to never get injured in America, otherwise you are screwed. This should not be the reality that we live in, but it is.